Welcome to In Good Company, elder care in your backyard.
Hi, everyone, and welcome to the In Good Company podcast. I'm so glad you're here because today we're unpacking one of the most important and confusing topics in healthcare. Should you choose Medicare Advantage or Original Medicare with a supplement plan like Plan G or Plan N? If you've ever tried to compare plans or understand all the fine print, premiums, deductibles, networks, drug coverage, you know it can feel like a maze. But here's the thing. Making the right choice could save you thousands of dollars. That's right, thousands of dollars. And more importantly, give you peace of mind when life takes an unexpected turn. Let's start with the big picture. Medicare Advantage and Original Medicare with a supplement, or Medigap, are two completely different systems. They decide how you receive care, who you can see, and what you'll pay when something happens. Here's a revealing fact. In 2024, approximately 54% of eligible Medicare beneficiaries were enrolled in Medicare Advantage. By contrast, only around 42% of beneficiaries in traditional Medicare had a Medigap supplement policy. Now imagine this, a hospital bill for $200,000. Depending on your plan, you might owe almost nothing, or you could be left with a shockingly large balance. This isn't about scare tactics. It's about being prepared. Because when you understand the structure of your plan, not just the price tag, you're not just comparing premiums, you're protecting your future self. Medicare Advantage plans often advertise low or even $0 premiums. That sounds great, especially when you're living on a fixed income or trying to stretch your retirement dollars. But there's a trade-off. Advantage plans often come with a smaller provider networks, higher out-of-network costs, and sometimes plan changes from year to year. You might also face different copays or need referrals from specialists, depending on where you receive care. Meanwhile, Original Medicare with a supplement, such as Plan G or Plan N, usually costs more each month, but it gives you freedom of choice and predictability. Any provider that accepts Medicare accepts you. There's no guessing if your doctor is in network, and no surprise bills if your local hospital exits a plan's network mid-year. Consider this. Medicare Advantage enrollment translates into real dollars. MA plans accounted for nearly $462 billion, or 54% of total Medicare spending in 2024. And Medigap premiums aren't static. Average rate increases were around 7.8% in 2024. When you're dealing with serious medical issues or a large hospital bill, that kind of predictability becomes priceless. Let's put this into context. Imagine someone with an extended hospital stay, maybe surgery, maybe rehabilitation. A $200,000 bill isn't as rare as you might think. Under some Advantage plans, the annual out-of-pocket max could reach $8,000 or more, and that's per year. With some supplement plans like Plan G, you may only pay your annual deductible, and almost everything else is covered. That's why financial advisor Paul Morrison emphasized when we spoke to him, it's not just about the monthly premium, it's about predictability and access. Knowing you can see the specialist you want wherever you are without worrying about surprise costs brings a level of comfort that's hard to measure in dollars. Before you enroll or renew, here are 5 questions you'll want to ask. Does my plan have a lifetime out-of-pocket maximum? Does it cover excess charges if a provider bills more than Medicare's approved rate? How stable are the provider networks? Does my plan include the prescriptions I rely on most? If I travel or move, does this plan follow me, or do I lose access? Even the best-looking plan can cause frustration if your favorite doctor suddenly drops off, or your medication is no longer covered, and that happens far more often than people think. Here's a stat worth knowing. Nearly 96% of seniors with Medigap plans say their coverage allows them to see doctors and specialists they trust without major barriers. Here's something Paul emphasized. When you choose a Medicare plan, don't just think about this year. Think about 5 years from now. As we age, our healthcare needs will change. More doctor visits, hospital stays, maybe even long-term or specialized care. A plan that's affordable right now may become limiting later. Predictability and peace of mind often outweighs saving a few dollars each month, especially when your health and independence are at stake. And consider this broader trend. Enrollment in Medicare Advantage grew from 19% in 2007 to over 50% last year in 2024. Growth means more options, but also more complexity and change. Paul shared something deeply personal, his experience caring for his mother-in-law who lived with Alzheimer's. That journey changed how he views financial planning and healthcare decisions entirely, because he realized these choices are about so much more than money. They're about people. When families make these decisions, they're thinking about love, dignity, and connection, not spreadsheets. That's why it's so important to align your plan with your values. Choose coverage that lets you stay with your doctor. Access the hospital or facility you're comfortable with. And live with confidence, knowing support is there when you need it most. So now, what can you do right away to prepare? Review your current plan. Are you in Medicare Advantage or Original Medicare with a supplement? Write down your premium, deductible, annual out-of-pocket max. Project future costs. What happens if you have a hospital stay or rehabilitation? Does your plan protect you from large unexpected bills? Ask specifically about excess charges. Not all plans cover them, and they can add up fast, especially if you see specialists. Compare your options early. Don't wait until the last week of open enrollment. Look beyond premium prices. Check provider networks, drug coverage, and whether your preferred doctors and hospitals participate. If you're a caregiver for a loved one, help them identify what truly matters. Trusted providers, local access, predictable costs, peace of mind. When it comes to healthcare, being informed means being empowered. A little research now can prevent a lot of stress later. At the end of the day, the best Medicare plan isn't just about cost. It's about confidence. Confidence that you'll have access to the care you need when you need it from the people you trust. So whether you're planning for yourself or supporting someone you love, remember this. Knowledge is your best protection, and compassion is the foundation of good care. Thank you for joining us on In Good Company, Elder Care in Your Backyard. If this episode helped you, please like and subscribe and share it with someone who could use a little clarity and peace of mind. Because together, we can make healthcare choices that are informed, confident, and full of heart. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company, Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.